Systemic complications with IV therapy. Air embolism may be caused by empty solution container. Solution container empties, next container pushes air down line. Tubing disconnected from venous access device or IV bag. Signs and symptoms include respiratory distress, unequal breath sounds, weak pulse, decreased blood pressure, confusion, disorientation, loss of consciousness, increased CVP. In order to prevent air embolism, you must purge the tubing of air completely before the infusion. Secure all connections, use an air detection device on the pump or an air eliminating filter proximal to the IV site. Nursing interventions include discontinue the infusion, place the patient in Trendelenburg's position on his left side, place oxygen as ordered, monitor vital signs and pulse oximetry, notify physician, document patient condition and interventions. Allergic reactions. Possible causes include allergens such as medications. Signs and symptoms include itching, tearing eyes, runny nose, bronchospasm, wheezing, urticarial rash, edema at site, or possible anaphylactic reaction, which may occur within minutes or up to 1 hour after exposure, including flushing, chills, anxiety, agitation, generalized itching, palpitations, paresthesias, throbbing in ears, wheezing, coughing, seizures, and cardiac arrest. In order to prevent allergic reactions from occurring, you must obtain the patient's allergy history. Be aware of cross allergies. Assist with test dosing. Monitor the patient carefully during the first 15 minutes of administration of a new drug. Nursing interventions include, if reaction occurs, stop infusion immediately and infuse sodium chloride as ordered. Maintain a patent airway, notify the physician, administer medications as ordered, and document. Circulatory overload. Possible causes include roller clamp loosened to allow run-on infusion, flow rate too rapid, miscalculation of fluid requirements. Signs and symptoms include discomfort, neck vein engorgement, respiratory distress, increased blood pressure, crackles, large positive fluid balance, which is intake greater than output. In order to prevent circulatory overload, use a pump or a volume control set or a rate minder for elderly or compromised patients. Also, make sure that you recheck your calculations of fluid requirements and monitor the infusion frequently. For nursing interventions, you want to raise the head of the bed, slow the infusion rate, administer oxygen as needed and ordered, notify the physician, administer medications as ordered, monitor vital signs, and document. Systemic infection, also known as septicemia or bacteremia. Possible causes include failure to maintain aseptic technique during insertion or site care, severe phlebitis, which can set up ideal conditions for organism growth, poor taping that permits a venous access device to move, which can introduce organisms into the bloodstream, prolonged indwelling time of device, and immunocompromised patient. Signs and symptoms include fever, chills, and malaise for no apparent reason, contaminated IV site, usually with no invisible signs of infection at site. Nursing interventions include notify the physician, administer medications as prescribed, monitor vital signs, culture the site and the device as ordered, and document. In order to prevent septic infection, you want to use scrupulous aseptic technique when handling solutions and tubings, inserting the venous access device, and discontinuing the infusion. Secure all connections, Change IV solutions, tubing, and venous access device as recommended.